In your post-operative course, I'd like to offer 5 bits of advice. The first is in relation to the exercises you'll be shown. Just do the exercises you're shown and the amount you're shown. Doing twice the amount of exercises that you've been given will not make you better twice as quickly. In fact, quite often it'll slow you down. The next thing patients often make a mistake with is trying to give up all their painkillers. So the common thing is they've got themselves nice and comfortable, they're walking really well, and then they think, oh, I'll stop all my painkillers now. And then they wake up the next day and they can't get out of bed. And the reason is that it's very helpful to have some low-grade painkillers in the background. It just needs to be paracetamol, something like that. Just takes the edge off things, allows you to do the exercises, allows you to progress more quickly. So don't give up your painkillers too quickly. And certainly don't give them up in one go. The next one is not overcommitting what you want to do after your surgery. What people often do before an operation is have an incredibly optimistic view about how they're going to progress, what they're going to be able to do, particularly in relation to work. Give yourself some time, tell people it's going to take longer than it really will, and then what you can do is introduce things on your own terms so you can achieve them easily. So please don't tell work you're going to be back at 2 weeks. Give them a longer expectation and then do go back to work on your own terms because you'll find it much less stressful. The next thing is in relation to your crutches. I will show you that you can walk without your crutches before you leave hospital. Please use your crutches though to help you rehabilitate your muscles without overstretching them, without overstressing them. Patients who give up their crutches too quickly often progress more slowly. So please don't regard your crutches as a sign of failure. They're just a sign of helping you progress with the best outcome because we're trying to teach you to walk normally again. At some point you'll forget your crutches and then you know it's time to give them up. But please don't regard them as a sign of failure. They are there to help you. The other bit of advice I give patients is always to try and have a bit of a rest during the day, because what will happen is after your surgery you're going to feel quite tired to start with, and so you need to factor in a rest. It's not a bad thing to feel tired, it's part of the rehabilitation process. So in the afternoons factor in a bit of time to relax, have a rest, put your feet up. If you try and work through the whole day without resting, by the end of the day you'll be going backwards, not forwards. So to enjoy your recovery, build in some rest. And if you follow these 5 simple things, most people will recover with very little difficulty.